The last 20 years have brought us significant innovation in what we call osseointegrated technology, or putting little fixtures into the skull, allowing bone to grow into it, therefore osseointegration, that we can then attach hearing devices so that we can overcome conductive hearing loss for somebody. And those are people who have a good cochlear function. Their inner ear, their nerve is working well, but we just can't get sound there. This could be people that have had multiple ear surgeries that have not worked to restore their hearing. This could be people who have lost all hearing in one ear, and this osseointegrated device could take the sound, route it to the other ear, and you would hear both sides out of your good ear. That would be a single-sided deafness indication. The basic approach is, if you were to take a model of the ear, we come behind the ear, and in the percutaneous devices, there's a small abutment that comes through the skin. And we would do in this situation is we would take our device, attach this on, and this is what the patient would have on their head, with sound coming through this hearing device and going to the inner ear on the same side or going to the inner ear on the opposite. When you're not wearing it, you still have this stainless steel fixture that for most people, you can't see that. It's hidden in the hair, but it does require care and cleaning each day. So we typically have people wiping these with a baby wipe, which works as a very nice disinfectant. We also have them using a soft bristle toothbrush in the shower to keep it clean. There are a couple of products on the market for this. One would be the Ponto by Oticon. The other is the Baha by Cochlear. This is a model which actually, I think, nicely shows you through a clear model what it looks like to have osseointegration. So you have the fixture, which is in the skull, modeled here by the clear resin, and the bone actually grows into that and makes it part of your skull, which allows you to then put on a abutment and attach a device for a percutaneous device. Now, let's just say you don't want to have anything showing through the skin. We can put that same abutment in, or same fixture in, and not place this component that comes through the skin. That would be a transcutaneous device. And there are 3 of these transcutaneous devices now available that we implant surgically. One is the Oticon Sentio device. The other is the Cochlear Osia device. And the third is the MED-EL Bone Bridge. And this is an example of the bone bridge. And what you see is a component that we actually place through an incision behind the ear, just like we would do for mastoid surgery. We create a pocket, very similar to what we do for a cochlear implant, and we slide this device into the pocket under the skin, and then we use 2 screws to attach this to the skull after drilling a small well. The operation, again, for a percutaneous device like the Ponto or the Baha is about 20 minutes in the operating room. We can do this under a local anesthetic or with a general anesthetic, depending on how comfortable you want to be and how much tolerance you have for just hearing people working around you. When we do the transcutaneous devices, we do put you under a general anesthetic, totally asleep, and it's typically about a 30 to 45 minute experience. We let the integration occur for about a month, and then we go ahead and activate your device. The patient satisfaction in these is very high. When you look at the potential complications, if you have a device that has a percutaneous component, the biggest complication is people who get inflammation and irritation around the actual abutment. We remedy that by regular cleaning. Oftentimes we'll have to put a steroid cream on it if it does get inflamed, and from time to time they require antibiotic management. Most patients, well over 85%, don't have any issues with cleaning their abutments over time. With the transcutaneous device, the risk would be extrusion or coming through the skin. We really reduce the chance for that happening through our surgical technique. Any device that you implant can fail. If you have a transcutaneous device and it fails, it would require another operation to replace it. All of those complications occur in less than 5% of the patients that we take care of. So that's the osseointegrated technologies. Again, very low risk in surgery and very, very good positive patient outcomes.